Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why.
Good evening. We are joined by the illustrious Miss Jocelyn Turner, my favorite co-host. Miss Turner, how you doing?
I'm good, and you, Dr. Kane? I know you were panicking, like, "Oh my God, where is she?"
No, not really, because I figured you'd be here. But as long as nothing, I felt safe that nothing was happening to you. You were not harmed in any kind of form or fashion. I knew you would be.
Since I just got off the phone with you like 10 minutes before
10
the
minutes
show,
ago,
right?
yeah.
Good evening, Tyrone. How are you today?
I am doing awesome. Awesome. Thank you for asking.
It's so nice to have you come from behind the scenes again this week. I mean, you're becoming we can't call you the behind the scenes guy anymore. We have to call you the guy.
The third leg.
So Dr. Kane and Tyrone, tonight is going to be an interesting topic because I'm going to tell you why I was delayed, and I apologize to our viewers, audience. How about I say audience? Because I was listening to something that was a little disturbing to me, Dr. Kane, and I'd like to ask you to explain to me and Tyrone and the rest of our audience, what's the real deal behind, or why did the Surgeon General of the state of Florida, or help us to understand the Surgeon General of the state of Florida's recommendation about men under 40 should not get the COVID-19 vaccine? Help us out.
So from what I read that he said, and I'd like to see a little bit more. From what I read that was printed out, or was printed and published, was that he felt that men that under 40 that got the COVID vaccine, the mRNA version of the COVID vaccine, that would be the Pfizer and the Moderna, that they had an 85% increase, in
myocarditis and pericarditis.
Yeah, pericarditis, myocarditis, heart-related issues. Now, let's put that in a proper perspective, because the thing that I did read, and I need to get a little bit more in depth in terms of what he said, because I hadn't had a really a good chance of listening to any publications that he put out. The thing that he said was that because it does have an 85% increase in developing heart-related issues, as just opposed to those who did not receive an mRNA vaccine. Let's look at the reality of the situation, what an 85% increase means. Let's say it was 100% increase in terms of the cardiac abnormalities. If that cardiac abnormality occurred on a normal basis without involvement of mRNA vaccine or anything else, was 1 in 100,000 men, 100,000 men's lives, 100,000 years of men's life. If you got 100% increase, that'll be 2 in 100,000.
Mm-hmm.
You weigh that risk against the risk of what you can do or what can happen to you with COVID. As we all know, we know people that have died, they were under 40, they was in good health, and it had nothing to do with the vaccine because the vaccine wasn't available at that time. Mm-hmm. You weigh that risk versus what he made the statement was, and it's like, that doesn't make a lot of sense. If you're a gambling person, you don't want to gamble on the side where you have a greater chance of losing. You want to gamble on the side where you have a greater chance of winning. So even a 100% increase if it's 1 in 100,000 cases or people, that is not that big of a increase as it relates to the overall numbers of people that are dying or are harmed from any cardiac abnormalities. So, and how did they? The other thing that got me concerned was the studies in itself. The one thing that we had when it was first published, they took him off Twitter because they deemed it as misinformation. He came back with some kind of study that they supposedly did, but there was no peer review, meaning your colleagues didn't look at it and see the validity of a study. And there was also that study, really, they didn't give us the whole dynamics of that study. They just told us, here's the study that was done. Don't know who did it, how it was done. At least at that time, it wasn't being published. Eventually, Twitter put it back up because they claimed to have that opinion supported by a study. But again, Twitter didn't use any experts that were scientifically inclined to review studies the way it is. Say like our guest host that we've had in the past, and particularly I'm referring to either an infectious disease person and or my other favorite physician, which is Dr. Kim Barbell Johnson, because she does clinical research and she knows the significance of how you go about doing studies and what they actually mean. So we don't have anything to review what he said. There may be some politics behind it. I think it is, but that's just a personal opinion about why.
Well, they on the news, they interviewed the president of the Duval County Medical Society Foundation, and he talked about the difference between misinformation and disinformation. And this is important to know as we talk about tonight's topic of why you need a primary care provider. So Let me just read to you what dictionary.com, we hope that's a reputable source. What dictionary.com says, misinformation is false information that is spread regardless of intent to mislead. And we human beings, newsflash, are not perfect. We can all make mistakes. We all forget things. We mishear or misremember details. But again, misinformation is false information that is spread regardless of intent to mislead. Now let's talk about disinformation. Disinformation is misinformation that is knowingly, intentionally spread.
Mm-hmm. Yep.
When you talk about that, and the reason that I brought that up, not only because I just heard the doctor talk about it on television,
Dr.
the news,
Dr. Snell.
Dr. Joshi, but the reason I brought it up is because oftentimes a lot of this generation, generationally, we all rely on our cell phones. You can't see it because I have the screen image behind me, but we rely on our cell phones, our computers, and whatever, right? We go online to get information. But I am a believer that having someone that you can pick up the phone, call, make an appointment for, go and visit, who knows your health, who knows what's going on with you and your medical condition, and that is a primary care provider. That is where you get your information, and not even from dictionary.com. I jokingly said dictionary.com because I just wanted to see the difference between misinformation and disinformation. While we don't know why Dr. Ladapo put out that information that he did, the point that I'm trying to make, and Tyrone, you can chime in, that the importance of having a primary care provider who knows your medical conditions to help you make decisions that's best for you, not a general population of what may be happening with 10 other guys, right? Am I wrong?
No.
I agree. Yeah. But here's one of the things that I heard Dr. Kane say, and I think is really important. He barely alluded to it. It may be political. Well, let's be honest. It is political. And so many things have a tendency to have the slant of politics. because, and I'm just listening to this and hearing it from both of you for the first time, but here's what I heard. I heard they took some information that is factual. There is an increased risk. Anyone they say that to, they can then rely on the fact that there is an increased risk. Dr. Kane, what he did us is he told us what the original risk was. And if you had an increase of that, just how few people we're talking about. I'm going to tell you what it made me think of. The first time I was going to get milk and they were out of whole milk. My wife said, well, just get the 2% milk. And she said, well, it's almost the same. I said, well, I didn't know it was almost the same. She said, well, you know, it's only 4% fat in the whole milk. I'm like, oh my God.
Newsflash.
But it changed my perspective because I understood the details. So when you tell me a lot of more people are going to be infected, then I'm thinking, oh, I could be one of the more people. But when you tell me that the infection rate or the effective rate is already 1 in 150,000, and then you're going to increase that, and he was liberally saying, okay, if it's 100%. Well, we know it's not, but it's still, the numbers are small when compared to the risk of doing nothing and contracting COVID.
Right.
Thank you, Tyrone. I'm glad you say it like that. But now I'm going to punt it back to you and ask you this question as a non-medical person. Why don't men like going to the doctor on a regular basis? Why do you think that is? Just from your personal perspective.
Well, I think there are a lot of reasons why. Well, most men who are at the age where when we're younger, we have this mindset of invulnerability. So when you're in your 16 through 25, hey, I'm the man. I ain't no doctor. Brush it off. Then when we get to the age where we start to have more ailments, we're caught up into the macho attitude. See, when I was younger, I ain't have to go to the doctor, so I ain't got to go now. And it's got to get mighty bad before we decide to go. And then we get to the age where we have no other choice. We're now suffering from things that could have been mitigated had we just followed steps along the way. So the answer to your question is ego, ego, ego.
Yeah.
And I also, go ahead, Dr. Kane.
I think you had a key point there, and that we have that sense of omnipotence, and invulnerability when we're much younger.
Yes.
The other thing that I look at as well, growing up, and I know these young folks going like those eons ago, but we were not we didn't have healthcare available to us like we do today. We didn't have the healthcare information available to us like we do today. The problem sometimes is just today, just opposed to years before when we didn't have information at hand, is Mr. or Mrs. Google, whichever way you want to look at it, and all of a sudden people are doctors or healthcare providers, and their friends come back and say to them, well, you need to do so and so because this is what I read, and it may not be a reputable source. And my answer to them always is, you say your friends say, yeah, what kind of work they do, and they tell me what kind of work they do. And I said, and most of the time they're not mechanics, but I do ask them, so would you let them work on your car? And the answer would be HELL, no. I'm going like, so you trust them to work on your body more so than you do to trust them to work on your car. And the light bulb goes off and some people get it.
Yeah, and just to further the discussion, that's why it's important that we understand the recommended health screenings that we should take, the different guidelines. We're younger, our parents pretty much are in control of our health issues, right? and
Yep.
making sure that we're going in, getting those important vaccinations. Oftentimes, at birth, you're going to get vaccines. As you're going to school, you get your vaccines. And then if you are lucky enough to be athletic, because I wasn't, because I had bad knees, right? Then you may get sports physicals. But then beyond that, people then have to initiate those recommended health screenings based on the different ages and stages of life, as well as your gender. For example, we always have promoted throughout all the education that we've been doing in the community, Dr. Kane, the importance of knowing your numbers, for example. And that is knowing your blood pressure, your cholesterol, your glucose level, in men, their PSA level when that time comes. But we also, and you can chime in on others, but we also need to know our family health history, right? I don't know about either of you, but there are diseases that may be prevalent in some families that they may not even, didn't know that it was in their lineage, right? But a lot of times I like how people get excited in the summer that preparing for family reunions, right? I always told people, as you're doing your family tree for your family reunion, write diseases by each of your family members' names that they have or they died of if they're no longer with you, because it is important, particularly if there are any rare diseases in your family, or if it's diabetes, something that's hereditary, for example, then you plug that next to that person's name. Obviously, that's not going on your family reunion T-shirt, but it is going into your family reunion book for you to add that to your family's legacy, because it is important moving forward. So, Dr. Kane,
Well, hold on, let me ask a question here, Ms. Johnson. And this is something that has always been an interest of mine. The way you go to the doctor is more so geared toward women.
Mm-hmm.
And I say that because I've never been to a doctor's office where the football game was on. Mm-hmm. You're talking about knowing our numbers. The way it's dispensed is not conducive to the way men think. So it's always a chore for them to go. But you talk to a guy and ask him the numbers of his favorite baseball, football, basketball player, and boy, they can run them out right there, because those programs have created a system that gears to the way men think. Women can go to gynecologists, women can go to specialists within that field, and they have a system from start to finish that is more apropos for the way women look at medicine as compared to the way men look at medicine.
Totally agree with you, Tyrone, because that's why I started really with, and mentioned that if you happen to be athletic and you're involved in athletics at your sports at your school in middle or high school, or even go back a little earlier, if you're in the community, what do you call the youth
athletic league and stuff,
right?
Like
youth athletic leagues and stuff like that, right? So if you happen to be athletically inclined, which everybody isn't, because I've met some guys who are not into sports, right? Well, then you're going by force to go to the doctor, getting those sports physicals and things like that. And you're absolutely right, Tyrone. Once those young men, if their athletic career stops at that point, if you happen to be lucky enough to be on the high school football or baseball or basketball team, you graduate from high school and that's it. You're not into sports anymore. Sadly, and Dr. Kane, you can tell me if I'm wrong, sadly, those same guys probably won't show up at the doctor until their late 30s, early 40s. And then at that point, as I say, using a terminology that one of my friends said, they so broke down at that point. But that whole gap between, and this is not a show about bashing on men, by the way, because women are just equally, we don't take care of ourselves always and go to the doctor as young women, except we have the annual Pap test that we are recommended to have. And hopefully this won't offend anybody, but for those who might be in the faith community, but we talk about the real deal here on Pause for the Truth.
Yeah.
If you're sexually active, that's when you go to the doctor because you're trying to get some birth control products, or if you happen to be unfortunate, man or woman, and got an STD and have to go in for that reason. But it's just so many. And Dr. Kane, you can tell me, am I wrong, or Tyrone, if you've ever known anybody in their 20s who were diagnosed with high blood pressure or diabetes. Those are not diseases that are limited to older people. Am I right?
Right. And I've noticed with family members that it's more and more prevalent now in younger. I have a nephew who is, in his 27, 28, 29, who's diagnosed with high blood pressure.
Wow.
Well, when we were growing up, most of our food was at the dinner table was from mom. It may have been wherever the source came from, but mom usually cooked. Okay, that did not involve all those processed foods. And if y'all recall, particularly again, we're in that age group that we're old enough to recall some of that. You had, you may have had stuff, a lot of fried foods. And so you had Crisco, which you fried for this and fried for that. You had your fish grease, you had your regular grease. You reuse that Crisco, and it was refried grease. The difference was we did a lot more physical activity back then, particularly when it came to the kids. When it got hot in the middle of the day, one of the things that we wanted to go inside and just sit inside the house, but the parents made you go outside and play because their thing was, and they knew better than we do, whether it was for the right reason or the different reason. They knew physical activity would help mitigate illnesses and stuff that become, particularly African Americans, because we did not have the availability of healthcare, much like our Caucasian counterpart. Sometimes, a lot of times, you had to go 100 miles before you saw a Black physician or a physician of color. So a lot of time it is based on your understanding of what and your training from your parents and the things that they did. Because they didn't go to the doctor, wasn't because they didn't want to go, it was because they either could not afford it or there was no physician in the immediate vicinity. We still have plenty of places in America where it's hundreds of miles before you can get to a provider. And just allude to some of the things you just mentioned in terms of the cholesterol and know your numbers. In a nutshell, and I'm really just kind of condensing the whole thing. That is kind of like 5 major risk factors to sudden death. Okay. Smokers, all right, a person that smoked, high blood pressure, elevated cholesterol, a family member, since going back to what you said, Ms. Turner, a family member or yourself who has had a heart attack before the age of 65. And then the other thing is diabetes. Now, diabetes is considered a risk equivalent, which means if you have a person who has diabetes, they may have the same risk of dying from a heart attack as a person who's had a previous heart attack. Okay. Wow. So to explain that difference, if Ms. Turner, if you had a twin that you guys were exactly alike with everything, with one exception, they have had diabetes but never had a heart attack, and you have had a heart attack but do not have diabetes, you guys pretty much have the same risk of having a heart attack in the future. Wow. That's why I know your numbers are so important. And by the way, you're not bashing men. It's just that women, as the father of 5 girls, y'all just smarter than most of men.
So tonight we're talking about
I'm the father of 2 boys.
I got a son, but I guess like my mom said, with the boys that she got, we such knucklehead. It was 4 and 4, 4 boys, 4 girls. The boys were the knucklehead, and I'm one of them. Quickly to say that I did things that were not copacetic with good health. Took risks that I shouldn't have taken, and the girls didn't usually take those kind of risks. That's why they live longer than most of the time. They live longer than men.
So tonight we're talking about why you need a primary care provider. To our audience, if you've had an instance of if you did not go to see your primary care provider, what would have happened? Or did you have an instance where you were having some issues and you didn't go to see your primary care physician or provider and something happened? Dial in now and let us know. We'd like to hear from you tonight as we talk about why it is important to have a primary care provider. So again, just to continue the discussion, we talked about knowing your numbers and why you need a primary care provider. There are some things, and you kind of alluded to, Dr. Kane, there are some things that we cannot do anything about. We can't do anything about who our parents were. We can't do anything about being a male or a female, even though some people will make a change in life. But that's essentially, that we don't have control over those diseases that we are susceptible to because we're a male or female, or because who our parents were, because of our race or ethnicity, our age, sometimes in some instances. What else, Dr. Kane, are we susceptible to? And the reason I like to bring those out first is because then I'm going to talk about those things that we can work with our primary care provider on to reduce our risk, because we can't do anything about those things. Did I miss anything, Dr. Kane?
No, the only thing I will expound upon is that earlier in life, what we would see at times is, let me put it this way. I'm an older individual, okay? And I remember the days in which, like I said, we would obtain our food sources from mom and what she cooked and so on and so on.
Mm-hmm.
Now we got a lot more processed foods, okay, because of convenience. Whether or not we got two-parent household or a single-parent household, a lot of convenience are out there because of fast foods. And fast foods are generally very processed related foods. So a lot of salt, okay? And up until recently, when people became more concerned about what type of hormones were being placed in, or how our sources of meat were being obtained, a lot of it was whereby they injected hormones and or other materials in the foods to increase productivity so that they can increase profit. And so, we don't eat a lot of fresh vegetables. It's very easy to run up to the neighborhood Chinese or Oriental
Fast food.
Yeah,
fast food in general.
Mm-hmm. Yeah, fast food in general. But the only reason I mention that is because a lot of times it's very high in sodium content and high in fat. And so, I have patients that say, hey, look, I got broccoli, I got rice, I got this, that, or the other. I got brown rice, but in which we sometimes say brown rice is great, but not browned rice, which is white rice brown because we added soy sauce to it, which soy sauce is just pretty much liquid salt. And, so your sodium content really goes up significantly. And African Americans, by the way, have a much higher risk of having high blood pressure because there's a difference in terms of, truth be told, how we may process sodium compared to our Caucasian counterparts. Now, that's a generalization, but that's why, when you look at some of those labels, they tell you the daily recommendation for sodium is 2,400 milligrams. Well, in my practice, I said for African Americans, 1,600 milligrams, because we tend not to get rid of sodium as easily or as quickly as our Caucasian counterparts. Now, again, this is not trying to be a racially directed comment, but it is what it is in terms of what we go through. And again, we have those food deserts, things that we've talked about in the past. We have those food deserts where we don't get the fresh vegetables, and we're mostly getting all these fast processed foods. So,
well, Dr. Kane, let me ask you a question here, because I noticed you said something, and this is something I hear oftentimes, is the statement of it's processed food. Fast food is processed food. Well, that sounds good, even though it's bad.
right.
So tell me, when you say it's processed food, what does that mean?
Well, when you go to McDonald's, Burger King, and places like that, they're trying to move that food. They're trying to get that food be able to be prepared quickly. Okay. And so, and that means they don't give you necessarily the fresh foods, that fresh meat and stuff that you would like to have, because it's not conducive to them being able to prepare your food quickly. Okay. And so they have to put a lot of preservatives in that meat and other, food sources, let's say like frozen dinners. They have to put preservatives in that. So what's the cheapest preservative they got out there? Salt.
So,
So when you go and look at your Swanson dinner, it may say 800 milligrams of sodium in this dinner, but it's 800 milligrams per serving. How many servings in that dinner? It may be 2. But who cooks a half of a frozen dinner? So they wind up eating the whole thing. So now all of a sudden, that 1,600 milligrams of sodium that I'm asking you to kind of limit to is done in one meal.
all right, so you're saying that processed food is food that they've pre-prepared. They've added more salt in it for preservatives.
Yes.
They've done things to make it last and stay longer to increase the opportunity for profit. So
Right.
when we're saying, or when a person, and when our listeners, when you're hearing processed food, what you should be thinking is what they've added. You should be thinking more salt. You
Right.
should be thinking less fresh, more preservatives. You should
Right.
be thinking that it's less real and more fake.
More, yeah. You go to McDonald's. I mean, somebody did an
Don't bash McDonald's, just say fast food.
Okay. But no, the reason I said McDonald's, when we were younger, we did like all teenagers did. After a football game or whatever, you hung out at McDonald's, and we loved, and I still, at least back then for sure, I love McDonald's fries at that time. But some people had this guy. He put some McDonald's fries away, and it was like a year and a half later he came back to those fries, and they did not deteriorate one iota. So, and we're talking in a place where it should have, most things start degrading, when you leave it out for too long, mold, mildew, all this other stuff.
Well, Dr. Kane, let me mention something that I mentioned a few months ago, and because it's something that I learned years ago that always stuck with me, and I'm gonna read it because I'm good for reading stuff online. Since I talked about it earlier, but I actually heard this at work while I was working at the health department. Data was presented by the American Cancer Society and the National Cancer Institute indicating that people born in 1990 are 2 times more likely to develop colon cancer and 4 times more likely to develop rectal cancer than people born in 1950, and largely due to high-fat diets.
Yep, because of those same fast foods. Here's another thing that, as a physician who over the years I saw the trends and everything, there was one time that the routine screening for colon cancer was to do what we call a flexible sigmoidoscopy, which only went about 50 centimeters into the colon. And at that time, what we saw was still we were seeing a high rate of colon cancer in African Americans than we've seen in Caucasians. And what we learned and what we saw a lot over the years was that, and this is a generalization, 70%, and again, a generalization, 70% of colon cancers in Caucasians were found on the left side of the colon. Okay. So the flexible sigmoidoscopy did okay for them. But in African Americans, what we found out was that 70% was on the right side of the colon, for which a flexible sigmoidoscopy did not go far enough to the other side of the colon to take a look. And, you know, it's like me and we had Dr. Jones on last week. We speculated at that time because of the high fat content in our foods that it was being dumped into that the right side of the colon coming from the small intestine, and that contributed, we thought, a lot to the development of colon cancer on the left side of the colon compared to the right. And so obviously we wanted our guidelines adjusted, for which over the years we did get that adjusted and did not really look at flexibles or use flexible sigmoidoscopy, much like today. When you go get a colonoscopy, they look at throughout your whole colon to be sure there is no colon cancer.
Yeah, one of the things that the study says is that it's largely associated with obesity, and obesity obviously is related to sedentary lifestyle in terms of not getting enough exercise and a poor diet. So one thing I like about the younger generation, girls they pride themselves being thick girls, right? They're not as hung up on it as past generations were, right?
Right.
Thick as in, oh man, like a guy that's a girl that has some meat on her bones. I mean, we've heard all sorts of things. However, when you're going to your primary care provider or even your OBGYN, they're going to probably talk to you about the importance of maintaining a healthy weight. It's not that you're not a beautiful young lady or a beautiful lady based on being a thick lady. However, it is based on your health, your health conditions that you're predisposing yourself to, like high blood pressure, high cholesterol, diabetes. And I mention those things because I've been transparent in the past about my journey. I was a person who had a family history of chronic health conditions. I went to college with the intent of getting into the health field because I wanted to know how to change the trajectory of my life as well as others. And so fortunately, I did that. I started practicing good health habits. And then as I got older and got more involved in work and bogged down with work and becoming a manager, I then started picking up what poor eating habits and a sedentary lifestyle. I stayed at my desk a lot at work rather than getting out, taking a walk. Those very things that for years I practiced, I was practicing what I was preaching, right? Then I had those years that I wasn't. Fast forward, when I become an old broad, then those diseases that I talked about that had I only continued to do what I said I would do and listen to my doctor, because throughout my life, I'm going to the doctor. We're not just shooting a breeze. I'm getting the lectures as well of Jocelyn, you need to do X, Y, and Z. Now, Jocelyn knew what to do because she knew how to, lose a few pounds to make the blood pressure come down for that medical visit, right? But then when she leaves the appointment, then she gets back to, well, it's going to come back to haunt you. But I was proud of myself when I shared with you all, our audience, about my diabetes journey. And that is, intellect had to kick in again. And I knew what I needed to do. And therefore, although I was diagnosed with diabetes 3 years ago, I've never been on medication because intellectually I knew what to do. And that is pay attention, go to the doctor on a regular basis. And your doctors are gonna expand, because it also included going to a foot doctor, because it's important that you look at your feet and make sure, because poor circulation, you don't know if you stepped on something, because sometimes some of us may lose the feeling, as we say in our and neurological issues that you may have, nerve damage, right? But
Right.
going to the doctor, going to the doctor on a regular basis, and making sure that you eat a healthy, low fat, low sodium diet. Watch the carbs. I'm not a registered dietitian. We've had smarter people on who are registered dietitians, and we'll have them again on in the future. But the point is, although there's a lot of good information online, you can go to the American Diabetes Association, the American Heart Association, American Cancer Society, the American Dietetic Association, and get all of those get information from all of those reliable sources, the Centers for Disease Control. Far too many people still rely on the dark web to help them manage their care. If you're listening, dial in, tell us what's on your mind as we talk about why it is important to have a primary care provider. The number is on the screen, 888-669-1280. Last week, Dr. Jones talked about when we were talking about breast cancer, Dr. Jones talked about don't let your one visit, and I'm paraphrasing, your one visit, you know your body better than anybody else. You may go to see the doctor once a year. It is important that you pay attention to what's happening to your body. And when something doesn't look right, you pick up the phone, schedule an appointment with your primary care provider, OBGYN, whomever. I say start with your primary care provider, because they then will refer you to the appropriate physicians or for some testing that you may need in order to do some further examination. Tyrone, you were going to say something.
Yeah, I was going to say, it is real awesome to be able to sit here at my age today and be able to listen to this information. I think what we do in giving our listeners, audience, as you would say, Ms. Jocelyn, this information is powerful. But when you were talking, I thought to myself, why is it the bad information or the misinformation is so much easier to retrieve than the good information? See, our society attempts to evolve. And there was a time when heavyset young ladies and men had a challenge in navigating their adolescence. So the individuals who went through that came up with body positive. You are beautiful. You are this and that. And that is the push. That's the information. But in conjunction with that, it's not the information of balance of you are beautiful, but just because you're beautiful don't mean you can't catch diabetes.
Right.
You know what I'm saying? So my question to you, Dr. K, I guess, is why is it in the medical field there's been less of an emphasis with regards to the newer generation that continues to pull information from the internet and these easy places? There's not as much good information readily available, or is there? I guess the question could be, is there?
That it is readily available, but I think let's be truthful about it. When I see a patient, aesthetics is not my concern, whether you're thick or thin, because I have thin women that have diabetes. So aesthetics is not as much of my concern as it is practicing good health and what Ms. Turner said earlier, know your numbers. So, without, and I don't believe in body shaming or anything along that line. But my concern is, or to elaborate on, or to discuss further what you said, it is because the money is there, so the marketing is there to sell certain products. I remember I had a lot of patients and a lot of friends, including some family members. Dr. Oz was the bomb. Every time you turn around with Dr. Oz, he had this going on and that going on. And many of us physicians going like, that is crazy. Don't believe what he tells you. And then eventually, and because Oprah brought him into the scene,
It brought him on the scene.
oh yeah, it was like Dr.
It
Oz
was
is
the gospel.
yeah, but Dr. Oz was a sellout. And I'm quite frank with you. And I think people can see now what Dr. Oz was all about. It was about the money. And that's to answer your question, Tyrone, in that one of the reasons that these messages don't get across is because it's not as profitable to tell you can do simple things to improve your health. And it's not as promoted as well because the money is not there, to sell whatever product this person wants to sell. Whether it's this stuff they talk Prevagen, I'm gonna call the names out, Prevagen for your memory. That stuff doesn't have, any proven benefit that it works. And what we have is what we call nutraceuticals, and they're nutritional products that have no proven value to them, except it makes somebody a lot of money. And so they take the airways and take prevalence over the airways as compared with somebody like us trying to say what's best for your health, okay? More so than the quick fix that I can provide you and make it look good that this is going to work. In the meantime, it's cha-ching, cha-ching, cha-ching for those people who are promoting those products that have not proven to be valid toward good health.
All right. So in other words, products make money. Knowledge and information does not.
Does not, but it keep you healthy.
Yeah.
And those products may not.
And I'm reminded, Tyrone, Dr. Kane and I for years were a part of an organization, the Healthy Jacksonville Men's Health Coalition, where we held a health summit for men and boys for over 10 years. And I tell you, we had the Dickens trying to get funding to help support our efforts to educate men about their health. You alluded to it earlier when you said a lot of the systems in place are for women and children. And we found that to be true. And although we had some supporters of it, and we haven't held an event lately because quite honestly, it just got tougher and tougher over the years to get financial support. And I often said to people, follow the data. You will see that men lead in most disease categories, right? Mm-hmm. However, the funding or resources to support that, to educate men, sure, we know that Dr. Kane can tell you, the events that had the star athletes present were the events that held the most, had the greatest attendance. When we had Dominique Wilkins, for example, he was in town to talk about his diabetes experience. When we had the first year, I think we had Rashad Jennings, former Jacksonville Jaguar. He spoke of his father's health condition, to see his father's health change. See, that's what happens with us. Things only become important when our loved one or we are ourselves sick, rather than empowering yourself to learn what do I need to do to make myself and my family healthy so that they won't be one of the numbers that we talk about. You know, Tyrone, better than the rest of us, how hard it is, and I'm being transparent now to our audience, how tough it's been for us to grow our audience when what we've done is created this platform to we give people an opportunity to write in the chat or either to phone in and ask us questions. We bring experts week after week on, or just simply have a conversation with the three of us sharing about health issues and things. However, it's tougher and tougher. But on the flip side, we can have a competing event about what some celebrity is doing, and people will log on for that, something that offers them no value towards their health or well-being, and people will chime in to that rather than something that could be beneficial to themselves and to their families. However, and Dr. Kane can tell you, and I'm not putting anyone down when I say this, Dr. Kane can tell you, however, when some folk that we know, they're going to call us. They'll call me and say, can you call one of your doctor friends and ask them A, B, and C, because so-and-so is happening with me or my family. Whereas I've been telling them all along, make sure you and your family are going in to see that they have that you all have a primary care provider and that you're going in for routine examinations. Don't reach out to the primary care provider when you all broke down and you're on your last leg and now you want to go to the primary care provider and blame him or her because they can't solve your 40 years of foolishness that you've been doing to try to make you healthy. And I'm not being disrespectful or anything. I'm just saying, I don't care if you're in your 20s, you still need to have a primary care provider to make sure that they are, and you may not have to go to the doctor as frequently as an elderly person. However, if you're going on an annual basis, at least somebody has a baseline of knowing what your health is today. So when, for instance, when my dad was diagnosed with prostate cancer, my dad was going to the doctor on a regular basis. His primary care doctor at the time told him, Ben, I noticed and his name was Ben. He's deceased. He died of lung cancer because he was a smoker years ago. I put it out there because I'm being transparent, letting you all know I'm not just telling you about anecdotal stuff. I'm telling you about my own family history. But my dad was going in on a regular basis to get his annual exam because working as a health educator, I'm telling him, making sure you go, Dad, and he did. Well, at the time, the primary care provider noticed a slight increase in his PS. So she sent him then to, no, Dr. Kane, you were not his doctor at the time. This is his former primary care physician who ultimately ended up getting cancer, which is how he ended up coming to you. But she said, Ben, your PSA level is slightly elevated. So she sent him for further examination. I remember when I went to the oncologist with him, and he said, boy, Mr. Turner, you're one of the rare patients I get to say you caught your cancer, your prostate cancer, in a very early stage, right? And so the prognosis was good for him. And so that was the point, that he was going to the doctor on a regular basis. And therefore, his doctor helped him to pinpoint, oh, I noticed a slight elevation. So I say that to say, don't wait just because you're seemingly a healthy person, because we all know someone whose health changed from last month to now. And, just today, and I'm not going to call folks' names out, just as sitting here, I've had knowledge of 2 people who tested positive for COVID, right? And so it's still happening, which is why we're telling people to make sure that you get your COVID-19 vaccine, because one thing that we do not know, and I'll let Dr. Kane say that.
Hold on 1 second.
I'll let Dr. Kane. Is that someone calling in?
Yeah, that's someone calling in. I just wanted to see if we can get them in. You want? Let me.
Yes, go ahead. Go ahead.
Well, give me just a moment.
Okay.
Okay, we'll keep talking.
And so, people need to go ahead and get the bivalent booster. If you've gotten 1 or 2 vaccines, or maybe you've only gotten 1 booster, you don't have to worry about getting 2 boosters and all. Go in and get that bivalent booster, because the last, and Dr. Kane, you'll have to help me out, the last dominant strain that was out there was Omicron. And so the bivalent booster will help protect you from the Omicron, right?
Right. Yeah, you remember we've done many of shows on COVID-19, and we talked about how the virus is just like all the rest of us trying to survive. So as we become up with more, we came up with more and more defenses against the virus, it mutated. Whether it was across the seas or over here, or whatever it was, it mutated, and so the antibodies that were developed during the original vaccination did not protect against the new variant that had occurred. So that's why we are always saying, let's try and make sure that you stay up to date on it. It's no different than the flu that we have, right? For years, That was a time that when we took that flu vaccine, it was very, very effective, 80 and 90% effectiveness. But that was because at that time, we could project from the strain of flu that was present in the Far East during their winter and stuff, that it would become the prevalent strain here in the States. But that was like a 6 months difference, 3 to 6 months difference in that. Well, because of technology and the world has changed, that now you can fly to the Far East and fly right back. You go there and get that virus and bring it right back in a matter of hours. So now we're trying to do the best we can with that flu vaccine to give us the kind of coverage we used to get. It ain't as easy because you're going back and forth, people traveling so much, day, yada, yada, yada. I do want to say this real quick.
Before we go into that, Dr. K, if you don't mind, we do have a caller. I would like to get them in, and I think they want to ask a question and make a statement. So I'm going to go ahead and bring them on, okay?
Go ahead.
Great.
All right, caller, can you hear me?
Yes, I can hear you. Hi, this is Jamila, and I make it a point to try and listen every week because the information is invaluable. There are a lot of people who may not make it to the fast food restaurants and everything, but they don't make good choices when they go to their local grocery stores, or they don't have the stores. Maybe they go to a corner store and still get jobs because they have limited resources. So some kind of way trying to, I don't know how we can educate them when they do get to their primary care provider. Then you have situations where they don't go to the provider because they don't have any, what they see as illnesses and those kinds of things. And then by the time they discover it, it's too late. No, and then number three, I just want to say, you guys have valuable people who are on, I try not to miss the podcast at all. And if there's some kind of way we can get folks to come on and hear some of the valuable information that you provide, and that's all I wanted to say, because there's some people, again, some people don't have providers because they don't have proper health care. And then by the time they do find out there's something wrong, they're getting their junk food at their local store and those kinds of things. That's all I wanted to say. And just keep up the good work.
Thank you. Thank you very much.
One of the things, and thank you very much, Jamila, for coming in and alluding to what we're at the Northeast Florida Medical Society and this foundation are trying to do, and that is educate the community. It's ironic that and we're going to have a show on this. If it's not, it may not be next week, but the week after that, we're going to have a show. Its enrollment time is coming up again, starting on the 15th of this month. And it's for the affordable health care. Can you imagine what would have happened? And some people want to poo-poo the affordable health care because it didn't get cheap as what we wanted it to be in terms of what we pay for it. But imagine what would have happened. We had this pandemic the way it did, and the Affordable Health Care Act was not in place. And remember, one of the great parts of affordable health care was not allowing a pre-existing condition to limit what kind of care you had. Based on what we've been experiencing with COVID, everybody would have had a pre-existing condition. And you would have been paying much more health care than what we're currently doing. I still think it needs to go down because, a lot of these insurance companies, it's all about a profit motive. But again, it could be much worse. Neither person on this broadcast may not be able to afford a health insurance like we want to unless you work for a company, because if you had COVID and it was documented in your chart, and because of all the side effects that have been associated with COVID, you would have had a pre-existing condition and you would have been paying higher healthcare wages. Just to envision what that meant, and so I know that's not the reason that they brought up affordable health care, but and it's not necessarily the only reason I'm talking about it now. But it was a godsend for many people who would not be with health insurance,
Mhm.
or even who would have been with health insurance, but would be paying an ungodly amount to do some of the things that we were able to do in lieu of COVID and its effect of society. I just want to make sure
Yes.
you knew that.
Yeah, and Dr. Kane, one thing we're also going to talk about in the future that's happening as a result of the pandemic, and I'm going to botch it up, so forgive me to the people who are smarter than me and know about it. But something may be happening called Medicaid unwinding, and that's where a lot of people who, because of the pandemic, were placed on Medicaid, right? Well, now those people, they lost their job, they were not working for months. People are still trying to recover economically from the pandemic, right? Well, there's buzz out there that those people who are on Medicaid are going to be dropped soon, and that's the unwinding. So we'll get the folks who are the experts on that to come on in the future if indeed that does happen. Now, just imagine if those folks who were not, they didn't have a doctor at the time because they couldn't afford it, because they were the working poor. They made too much money for Medicaid, but they didn't make enough money to buy health insurance, right? And so they're the working poor. But thankfully, the pandemic allowed them to have some type of health insurance or to have Medicaid coverage. Therefore, they're going to the doctor. Well, guess what happened in the interim? They got COVID, and they now are dealing with some health, long-term health conditions, and so they're going to soon be dropped because of politics. And how ridiculous and sad is that? Well, guess what, Dr. Kane and Tyrone? We're at the end of the show. Tonight has been enlightening. We like to call this pass the mic, open mic. It's a night when we feel that it's important for us to talk about what's on our mind, not necessarily what's on your mind, because that's what we like to say here at Pause for the Truth. We want to talk about what's on your mind. Tonight, we decided to talk about what's on our mind, and that is just reminding people of the importance of having a primary care provider. If you don't have one, stay tuned. Within the next couple of weeks, we're going to have a show with the experts to come on and talk about how to get yourself enrolled, or making sure your family member and loved ones are enrolled in some type of medical coverage, because more than likely, if they are not adopting healthy lifestyle choices, they are predisposing themselves to a chronic health condition. And we want to make sure that they do have a primary care provider to help them manage their health better. At the end of all shows, here's my line. We like to give our guests, and it's not our guests, it's our team members now, the opportunity to share their final thoughts regarding tonight's discussion. Tyrone, you're the non-medical or health person of the discussion. Tell us your final thoughts as we end tonight's show on why it's important to have a primary care provider.
All right. Well, then, first of all, thank you for allowing me to come from behind the scenes once again and participate in yet another thrilling topic. It's interesting when I have an opportunity to listen and to engage both you and Dr. Kane with subjects that are new to me, because I take a fresh perspective and I seek to learn something. So here's what my information I like to give is that it is very obvious that in today's society and world, where it's a fast-paced and internet and computer-based world for a lot of young, that they are influenced by influencers. But I want to tell you that the first influencers were each of us, your parents, your friends, and you never know how many people you influence until you set out to influence. So if you have a primary doctor, a primary care provider, if you have taken tests and you know people, then ask them. Be an influencer. Say to them, have you considered? Do you know? Now, sometimes you'll say that and be surprised. They'll give you some information. and it may save your life. I've heard from friends of mine at church who were working on a church program, and they were doing colon cancer for men, and they were doing the work. Their job was to clean up, set up, and do everything. So one day it was a slow day, and someone said, "Well, why don't you guys get tested?" They said, "Well, I don't want me to get tested." Well, we ain't got nothing else to do. Might as well get tested. Well, 2 out of the 5 guys who got tested had colon cancer. It was captured early, and they both lived to tell the story. So my thing that I like to pass on to our viewers, our listeners, our audience, as Ms. Johnson said, is become the influencer. Tell people, talk to friends, add it into your daily conversation. These things. We talk to friends sometimes 5-6 hours in a week, and you should be able to take 5-10 minutes and say, well, how did your last physical go? What are your numbers? Do you know your numbers? And then they go say, what numbers? Oh, girl, I'm so glad you asked, because this is what you need to do. You need to tune in to Pause for the Truth so you can find out what number. So once again, thank you for allowing me to be a part of this here information that we give to the public.
Thank you, Tyrone. That was I like that. You be your own influencer. I love that. Dr. Kane, what are your final thoughts?
It's going to be a little bit long-winded, but I need to include a whole lot of things. I think that a true friend will tell you the truth.
Yes.
They would take time, pause, for the truth, okay, to pass it on to you as to what they've encountered. I have people that sometimes don't want their friends to know that this has happened to them or that has happened to them. Those, if they're friends, they don't care about that other than they want what's best for you, period. You guys are friends. I can come back and tell you what's going on with me just as easily I can tell my family what's going on with me, because I know you have a concern for my well-being as well as your own. That's one. A primary care provider can do multiple things. They can help guide you through the maze of helping to prevent any further deterioration of your health. Everybody's going to die, okay? Mm-hmm. But we're looking to make sure your quality of life is very good until you do. Some things, I walk out there and get hit by a Mack truck, I might not have been able to avoid that. But I can't avoid colon cancer not being diagnosed by going and do the things that are being recommended for routine health maintenance. Get yourself a blood pressure cuff. Get yourself a thermometer. Get yourself a pulse oximeter, okay, to help see some of the things that may be going on with you early. And then, you also can get this thing. You've seen people with this device or heard or seen it on TV called Kardia. It can help us look at what may be going on with you from a cardiac standpoint. Your primary care provider is considered what they call a gatekeeper, to help take a look at what some of the things that you need to have done and get you to the right resources to get it done if they don't do it themselves. Okay. And so, like women with, they making sure that they have their routine mammogram, the annual breast exam, the annual PAP, checking for, HPV, particularly between 21 and 65. Women that are 40 and over for sure have a mammogram, but a self-breast exam, they say for women 40 and over. And as we learned last week with Dr. Jones, remember I told you the youngest patient I ever seen with breast cancer was 19. And I got bested with, that was one that they seen with 12. Okay. And I even had a patient today, he's a male. And I looked at him and he has one breast larger than the other. I'm happy he wore a shirt that I'm observing him and I see this breast larger than the other one. And now I got to go and look and make sure this is not breast cancer, because on average, about 1 in every 100 cases of breast cancer are men. That doesn't seem like it's a lot because 1 in 4 women may have breast cancer. It may not seem a lot unless you're that 1 in that 100. That's 100% breast cancer from your lifespan. So, get your colonoscopy and or certain things like screening colonoscopy. As we learned with the young man that was in Black Panther, who died of an early age of colon cancer, okay? And may have had a family history of colon cancer. And I think that's what I heard or something along that line. Can't be sure of that. You have a lot of people that grew up in the time of either the Gulf War or the Vietnam War, and they were exposed to various chemicals. And as Ms. Turner stated earlier, genetics play a key role in terms of what you're up against. So at best you can know your family history so that you can help protect you and your loved ones, because you want to pass it on to your kids. If I wind up with breast cancer, I want to make sure my son knows that his dad had breast cancer and that he, will go out there and make sure he is observant of what's going on with him, from a well-being standpoint. And the same thing had what happened with my babies and their mom in terms of they had it. I want them to go and get checked. We didn't get into the specifics, but your primary care provider will know, does know, some of the specific that needs to be done on an annual basis, on a semi-annual basis, and will help walk you through what needs to be done. And lastly, also realize that your primary care provider can be a keeper of records. That when you go see other specialists and other physicians, that they make sure they send all of this to your primary care provider so that you can be sure you can go to one place to find out what has been going on with you from other providers instead of trying to track down all the medical records from all the different providers. So that's one of the things that for sure a primary care provider or place, a medical home, can provide for you. So do your best to make sure, and my patients know when they go see their specialist, my primary care provider is Dr. Kane. And as I got older, so did my patients. And I got patients been with me for 30, 35 years and would not go anywhere and saying, well, Dr. Kane, what are we going to do when you retire? It's like, we're going to get you another primary care provider to help follow through, just like I got one. So, and I have some colleagues, they're physicians, they're smart, but they did not have primary care providers. And there was a storm looming ahead. They did not, prepare for it as well as they should. And so we chased some that we should not be chasing. But I also had some that made sure that they had their a primary care provider. A lot of them is me, but I also have some colleagues that are just as good as I am, if not better. And they are, and I would recommend the patient to them in a heartbeat. Look at, and we talk about open enrollment, but we can talk about getting more detail later. When you start looking at your health insurance, look to see if the guy or a girl that you trust is on that enrollment, because if that's who you trust and that's who you want to keep, then you need to make sure that they are part of that plan. So, there's much more to talk about, but I just wanted to at least get those thoughts out to you. And when you don't have anything anywhere else to turn to, don't forget the Northeast Florida Medical Society and its foundation, as well as members of the Pause for the Truth, can help guide you to a primary care provider that will help look after you in your best interest.
Thank you, Dr. Kane, and thank you, Tyrone, and to our audience. Thank you, as always, for tuning in. As you can tell, we are very passionate about the topics that we bring up. We're passionate about making sure you are doing the best you can for yourself and your families. And I like to say that because some of us have elderly folks in our lives or children that we have to make sure that their health needs are taken care of. So the more you know, the better you're able to help make those decisions for yourself as well as your family member. Because one thing we don't want to do is have regret of making the wrong decision for our family members. But being a partner in your primary care providers, with your primary provider to help you manage your health is what tonight's show is all about. Stay tuned next week. We're going to talk about a subject that can be a little sad for some of us who may have known someone who've experienced it, or even for some of you who are listening. Next week, we're going to talk about domestic violence. It is Domestic Violence Awareness Month. And although it may not be prevalent in your circle of influence, it may be, and you just have not recognized the signs of it. Stay tuned for Pause for the Truth next week as we talk about domestic violence, and for a future show as we talk about the open enrollment, the Affordable Care Act, and as we continue the discussion on the future of healthcare. Thank you for chiming in to Pause for the Truth. Stay healthy. Go and get that bivalent booster, regardless of whether or not you've had a first or second vaccine, a first or second booster. It is the one booster that will protect you from the Omicron variant. Good evening, everyone.
Good
Get
evening.
Surgeon General. Good night.
Good night.